101, the answer is B. The right gluteus medius as well as minimus tilt the pelvis so that the left lower limb is raised They tilt the pelvis in such a way that the left lower limb is raised, thus permitting the left foot to advance forwards and clear off the ground. One 102, the answer is C. 103, the answer is B. If you look at the choices, the posterior obliterated umbilical artery is in front of the fossa. Basically, they have written the obliterated umbilical artery posteriorly. By posterior umbilical artery, they mean that obliterated umbilical artery is present posterior to the fossa, but actually it is anteriorly placed. If you look at the boundaries of the ovarian fossa, then the obliterated umbilical artery is in front. Ureter is present posteriorly, which is choice B, which is correct. Uterine tube is at the upper pole. And the internal iliac artery is present posteriorly. Coming to question 104, the answer is B. The parotid duct is also called Stenson's duct. And it opens in the mouth opposite the upper second molar tooth. Then the duct of the submandibular gland is also called Wharton's duct. It opens on the floor of the mouth on the summit of the sublingual papilla at the side of the frenulum of the tongue. One 105, the answer is B. The clergyman's knee is due to inflammation of the infrapatellar bursa. This is a subcutaneous bursa. Apart from this, we have a condition called prepatellar bursitis, that is inflammation of the prepatellar bursa, which is called housemaid's knee or miner's knee. So the clergyman's knee is inflammation of infrapatellar bursa, whereas housemaid's or miner's is inflammation of prepatellar bursa. Question 106, the answer is D. It is the odontoid process which is shown in the picture. It is also called dens. This is actually the body of C1 vertebra which has got detached from the C1 vertebra and it has got fused with the body of C2 vertebra. Question 107, the answer is B. Question 108, the answer is C. The Allen's test is useful in evaluating the integrity of the palmar arch. Question 109, the answer is A. The typical intercostal nerves are those nerves which supply only the intercostal spaces, and the typical intercostal nerves are 3rd to 6th nerves. The typical intercostal nerves are those nerves which supply only the intercostal spaces, and these are the 3rd to 6th nerves. The 7th intercostal nerve also supplies the anterior abdominal wall, and since it is supplying the abdomen, so it is not the typical intercostal nerve. Question 110, the answer is C. This has been discussed earlier. Question 111, the answer is D. Sustentaculum tali is a shelf-like projection which is seen on the medial aspect of calcaneum. The upper surface of this forms the talocalcaneo-navicular joint. The upper surface of sustentaculum tali participates in the formation of talocalcaneo-navicular joint. The lower surface is grooved by the tendon of flexor hallucis longus. The medial margin is related to flexor digitorum longus. The attachments on the medial margin are S, T, D, M. S for STD, M. S for spring ligament, which is attached on the medial margin anteriorly. T for tibialis posterior, which is attached in the middle. D for deltoid ligament, which is attached along the whole length, and M for medial talocalcaneal ligament, attached posteriorly. This sustentaculum tali can be fractured in forced inversion of the foot. Talking about the deltoid ligament now. Deltoid ligament is a very important ligament. It has two parts, superficial and deep. The superficial part has three parts, anterior, middle and posterior. The anterior part is called tibio-navicular ligament. The middle part is tibio-calcaneal ligament, and the posterior part is the posterior tibio-talar ligament. The deep part is the anterior tibio-talar ligament. Then there is another ligament which is important, which is spring ligament. Spring ligament is also called plantar calcaneo-navicular ligament. It is the most important ligament for maintaining the medial longitudinal arch of the foot. Question 112. The answer is A. This is the ulnar claw hand. The ulnar nerve is also called the musician's nerve. Ulnar nerve is the musician's nerve. In ulnar claw hand, we observe that there is hyperextension at the metacarpophalangeal joints, and there is flexion at the interphalangeal joints. This flexion at interphalangeal joints is more in the ring and little fingers as compared to the index and middle fingers. Than the index and middle fingers. This flexion at interphalangeal joints is more obvious when the ulnar nerve is injured at the level of the wrist. This is because the flexor digitorum profundus is spared in injuries at the level of wrist. So this is more obvious in lesions at the level of wrist joint. This is due to the sparing of flexor digitorum profundus. So this leads to flexion of the terminal phalanges, and this phenomenon is called the ulnar paradox. Why is it called the ulnar paradox? Because a lesion which is occurring more distally is producing more signs and symptoms. The signs and symptoms are more pronounced in a distal level injury. So this is the ulnar paradox. The intermetacarpal spaces are hollowed out due to wasting of the interossei. Then there is sensory loss. We have already done the sensory supply of the hand in one of the previous questions. So we know that the sensory loss is going to affect the medial 1/3 of the palm and the medial 1.5 fingers, including the nail bends, and the distal phalanges, and then the medial half of the dorsum of the hand. I have already explained this to you with the help of a diagram in one of the previous questions. Apart from the sensory loss, there are vasomotor changes. The skin is warm due to arteriolar dilatation. And it is dry. It is drier in the absence of sweating. Due to the loss of sympathetic supply. Dry and scaly skin in long-standing cases, nails crack easily, and there is atrophy of the pulp of fingers. Coming to question 113, the answer is D. In postductal coarctation of aorta, collaterals develop between the branches of subclavian and axillary artery. Subclavian and axillary artery with the distal arteries given off by the aorta. With the distal arteries given off by the aorta. Question 114, the answer is A, trapezius. Trapezius is supplied by the spinal accessory nerve. The spinal accessory nerve supplies two muscles in our body. One is trapezius and the other is sternocleidomastoid. Question 115, the answer is B. Incisions parallel to these lines do not gape and cause minimal scarring. Question 116, the answer is A. If we look at the other choices, choice B, the meibomian glands secrete lipid-rich secretion. The meibomian glands secrete lipid-rich. In the choice, it is given mucin-rich, so it is not mucin-rich. It is a lipid-rich secretion. Then the orifices of the meibomian glands, here it's given they are anterior to the root of eyelashes, but actually they are posterior to the root of eyelashes. Their orifices are posterior to the root of eyelashes and not anterior. Choice D, the lower lid is supplied by. The lower lid is supplied by the infraorbital nerve. It is supplied by the infraorbital nerve, which is a branch of maxillary nerve. And it is also supplied by infratrochlear nerve. Infratrochlear nerve, which is a branch of ophthalmic division of trigeminal nerve. So this is how the lower lid is supplied. Question 117, the answer is C. If we look at the other choices, then in choice A, they have written they are of mesenchymal origin, but actually they are ectodermal in origin. Ectodermal in origin. Choice B says they are shorter, but they are not shorter, rather they are taller at the fovea than elsewhere, and they become flattened towards the periphery. They are taller at the fovea and they become flattened towards the periphery. Choice C is the correct answer. Choice D says they form the inner outer blood retinal barrier. They just form the outer blood retinal barrier. They form the outer blood retinal barrier. Question 118, the answer is B. As far as the HLA antigen is concerned, the gene is coded by chromosome 6, There are two types of HLA antigens, class 1 and class 2. The class 1 antigens are seen on the surface of all the nucleated cells. They allow the cytotoxic T lymphocytes to recognize the virus-infected cells and eliminate them. Recognize and eliminate the virus-infected cells. The class 2 antigens are found on the cells which interact with T lymphocytes for example, Langerhans cells, and this is to initiate an immune response. Although graft rejection is reduced with HLA matching, but this is not true for all the grafts, because in rare transplant tissues like heart, it is limited to ABO matching. So definitely if you do the HLA antigen matching, it helps in graft acceptance. But in rare transplant tissues like heart, ABO matching is also required. Question 119, the answer is B. Basically, to keep the skull in the anatomical position, two horizontal planes are considered. One is the Frankfurt spleen, which is there in your question, and the other is the Reed's baseline. In the Frankfurt plane, an imaginary horizontal line is drawn from the infraorbital margin to the superior margin of external acoustic meatus. Whereas in Reed's baseline, this is a horizontal line joining the infraorbital margin to the center of external acoustic meatus. This is the auricular point. We can place the skull in the anatomical position by taking into consideration any one of these planes. If this plane is horizontal, that means the skull is in the anatomical position. Question 120, the answer is A. The primitive streak is initiated and maintained by the nodal gene.